to the Eccles Business Buzz podcast. I'm your host, Frances Johnson. I'm so excited to be continuing our series of conversations with the Kempsey Gardner Policy Institute's 2024 Informed Decision Makers. These are individuals and entities that are recognized for their unique contributions to the prosperity of our community here in Utah. These people and groups often perform important work behind the scenes and without much fanfare. Here today to get a little bit of the fanfare they deserve are Jerika Mays and Dr. Mark Johnson from the Seager Memorial Clinic. The Seager Memorial Clinic's mission is to provide underserved populations and individuals with free, easy-to-access, non-judgmental, charitable, medical, dental, vision, and mental health care. Everything the clinic does is 100% free to everyone seeking care. The clinic leaves a legacy of healing in the community by serving as a safety net for anyone struggling to access the traditional healthcare system due to financial, social, mental health, or other barriers. Located in Ogden, Utah, the Seager Memorial Clinic has completed 84,300 patient visits since 1988. Jerika serves as executive director of the Seager Memorial Clinic, and Dr. Mark Johnson is vice chair of the clinic's board and also serves as the clinic's volunteer medical director. Jerika and Mark, thank you so much for joining me today.
Thank you.
Thank you for having us. Thank you.
Well, Jerika, I'd love to start with you, and I'm hoping that you can give us maybe some context for why a place like the Seager Memorial Clinic is necessary in our community. What does healthcare access look like in Utah, and how many people here are struggling to get the care that they need?
Great question. Well, I looked this morning at the United States Census Bureau, and persons without, can I go again?
Yeah, of course.
Yeah. Great question. So I looked this morning at the United States Census Bureau, and they have a variety of demographic questions. And one question is they look at persons without health insurance under age 65. And I pulled the data. United States is roughly 9.3%. Utah is 9.1%, and Weber County is 9%. So just around 9 to 9.3%. In Utah, that equates to over 307,000 people who don't have health insurance. That's a lot of people. And what's interesting is if you look here in Ogden, where our clinic is located, we're at 14.7%. So that's over 12,000 people here in Ogden who don't have health insurance, who are struggling to access the traditional healthcare system.
I want to share some other statistics that I think help illuminate the issue that we're talking about here. And these are from the Seager Clinic's own 2023 annual report. You reported that 52% of your patients are uninsured, 68% of your patients live below the poverty line, and 39% of your patients report experiencing homelessness. And these all point to barriers that they would have to accessing healthcare, right? Either they don't have insurance, they are struggling financially, or have some instability in other parts of their lives. With statistics like that and the statistics you shared, Jerika, I think it becomes clear that we probably all know someone who falls into one of these categories, right? Either someone who doesn't have access to insurance, doesn't have the financial means to seek healthcare in another way outside of the insurance marketplace. Do you feel like we as a community are aware that our friends and our neighbors might be struggling in this way? And what can we all do to raise awareness?
I don't think, people's insurance status, you don't know if people have insurance or not without asking. And we do see many patients who are facing homelessness, many who are transitioning out of jail, people who may be undocumented, going through some type of employment struggle. I think of a story recently. We had a young family, and the father recently lost his job. And he called the clinic and said, "Hey, I've got 5 boys, from elementary age to high school, and they need to start sports, but they don't. We don't have insurance. We don't have money to go get a physical. Can we bring them?" And so they were able to come and get the physical done, and not have that moment of not having insurance be so difficult. So it could be, a family down the street that just lost a job, or a few years ago, the there was a government shutdown, and we saw an influx of IRS employees coming because they were struggling to afford the medications they needed. So it's a wide variety of people who come to us.
And I think these examples really illuminate that our access to healthcare can change very quickly,
Yes,
right? One day you have insurance and easy access to healthcare, and the next day that could be gone. And that can really happen to anyone. I also love the example you shared about the father with 5 boys because it shows um, kind of the domino effect that a lack of insurance can have, right? No insurance means my kids can't do sports, means maybe
yeah,
their mental health starts to suffer because they become isolated or separated from the activities that they want to do. So we're really talking about something that isn't just I can go to the doctor or not, but I'm able to access other things in my life that I enjoy and that I want to do.
yes.
So tell us, Jerika, now that we have an idea of sort of the need and why it happens and where it comes from, tell us how the clinic operates. What's the model that allows you to deliver all your services 100% free? And I think this is also interesting to anyone, right? So I could presumably, correct me if I'm wrong here, but I'm insured, but I could come to the clinic and receive 100% free healthcare if that was something that I needed for some reason. So tell us how it works.
Great. So in our model, we currently don't turn anyone away. So we see people who have insurance, but many who don't. And it's a first come, first served approach. They're able to sign up at the beginning of the clinic, and we just start at the top and work our way down. We're open Monday, Wednesday, Friday from 3 to 5 p.m. And on any given day, we're seeing anywhere between 10 to 20 patients. We always have 2 providers available, and we're volunteer based. So we have over 200 volunteers. These are physicians, providers, nurses, pharmacists, pharm techs, pre med students, phlebotomists, even non medical volunteers who are running our front desk. And the patient's able to be seen by a physician or provider. And then we have an on site pharmacy. So they're able to leave with the medications they need in hand.
And so volunteers obviously would help cut down on some operating costs. How else do you like financially support the clinic?
Yes. So we have 2 part time paid staff. Myself, who oversees our strategic goals as a clinic, and also I do a lot of the fundraising. So we rely heavily on philanthropic foundations supporting us, also private donors in the community. We receive financial support, but also people just donating medical supplies and things we might need. Um, and then we also have a paid clinic manager, and her primary role is overseeing all the volunteer scheduling and being there when the clinic's open.
I think it's so remarkable. We think of medical professionals as really busy people. And we know that from Dr. Johnson's schedule and even being able to meet here today and getting that on the calendar, that these people would volunteer their time to a cause like this. Dr. Johnson, talk to us a little bit about how you came to the clinic and why it's important to you to be part of volunteering there.
Well, I first got involved in the clinic actually um, 25 years ago during residency. So it's a family medicine residency at McCady Hospital, and um, we as residents got the opportunity to spend some time at the Seager clinic, and that's where I got introduced to it. So after residency, I continued to volunteer. And have just been involved ever since.
Well, we heard about some of the barriers, Dr. Johnson, that people can face when they're trying to access healthcare. So, right, these include their insurance status, maybe their immigration or residency, citizenship status, finances, and also mental health barriers, which I think is a really interesting one. Talk to us a little bit about these barriers and how the struggles that people might be facing can be made even more complicated if they can't access healthcare.
Well, I guess it can be a little bit like a vicious cycle. If someone uh, does not have medical insurance or has financial difficulties or a physical or a mental health problem, then that may make it very hard for them to get medical insurance. And in turn, if they don't have access to healthcare, um, then it becomes hard for them to seek employment. And so again, it's kind of that vicious cycle. I mean, just as an example, we've had patients who have had uh, difficulties securing jobs and getting through job interviews because of their poor dentition. And so a simple thing like that we might take for granted could be a big difference maker in securing a job, which is going to be most people's route to getting health care. So again, it's one affects the other. Getting health care, having access to health care can help secure a job, which in turn can help uh, secure insurance, which makes access to healthcare better. So we're kind of there as that safety net when someone doesn't have insurance or has financial difficulty and has this physical or mental health care need. We're able to provide that, and that I think makes them more marketable in the job market.
If you don't mind me, I'd like to share a story that I think really exemplifies what Dr. Johnson just shared. A few years ago, we had a case manager from the Department of Workforce Services reach out and say, "Hey, Jerika, I'm working with a client and he needs help." She sat down with him and he's looking for a job. And of course, you look at employment history, you work on the resume, and she noticed that he'd been applying to really entry level positions, fast food. And when she looked at his resume, he had been a truck driver for many years. She said, "Why aren't you applying for jobs as a truck driver? You could be making a better wage and also have better benefits." He said, "Well, I can't pass my Department of Transportation physical. It's a special physical you have to pass in order to operate a semi truck." And the reason was is his diabetes wasn't managed.
Mm.
His blood sugars weren't at a good level, and so he came to the Seager Clinic and met with one of our providers on our diabetic clinic day, and we were able to provide the insulin, the diabetic supplies, oral medications that he needed. And a few months later, the case manager, she let me know that he now had a job as a truck driver. He had passed that physical, and it was all because he was able to manage his health better.
That's amazing. And it gets to this other question that I want to talk about, which is the impact of access to healthcare on our community as a whole, right? So I think you made a great point, Jerica, earlier that people's insurance status is kind of a private thing. We don't know if someone is insured or not unless we ask them point blank, do you have health insurance, which I don't know that a lot of us are doing. So it's easy to kind of say, well, your healthcare is your business and your health is your business, and my healthcare is my business and my health is my business. But there are, I think, some community impacts when so many or any really of our friends and neighbors don't have access to the physical. And also, I just think mental health care is such a big component here. So when people in our community can't access those things, it impacts all of us. It can start to impact all of us. So Jerika, let's start with you. And then afterwards, I'd love to hear your thoughts as well, Dr. Johnson, on just the economic impact on our communities when more than half of our population is uninsured and has difficulty. Um, Actually, let me say that again because it's not half of everyone.
No.
Where should I start? Let's see. Okay, let's do this. So, Jerrica, I'd love to start with you. And then, Dr. Johnson, I'd love to hear your thoughts about this as well. What are the economic impacts on our community when almost 10% of our friends and neighbors don't have insurance to access healthcare?
Yes. So let's see. Um, well, you know, when, let's see, how do I want to phrase this? Um, we find that many of our patients are coming to us when, oh, sorry about this.
No, you're fine.
um, I think it's easy for patients who don't have insurance to put off their health. They might need to be seen, but they put it off because they don't have a point of access, or they aren't in a place financially to afford it. Even if they do have insurance, maybe the copay is a barrier, right? So um, patients might often put it off until it becomes an emergency, and they might go to the emergency room. And at that time, it can be a real financial challenge because that can be a big cost for the patient and their family. So I think by making it more accessible, they feel more comfortable coming to us in those early stages and receiving care before it becomes an emergency.
Dr. Johnson, how about you as we think about healthcare access sort of more holistically as a community? And I also think, because our health insurance is so often tied to our employment, we sort of think about it as a privilege, right? Like, I've worked hard, I have a job, I have the privilege of healthcare. But really, it's something that we all deserve, regardless of our employment status, our immigration status, our mental health care status. Everyone deserves to have the healthcare that they need to live a healthy life. So, it really is a right, I think, more than a privilege. Um, so talk to us about that, why we all deserve healthcare and what sort of happens in our communities when everyone doesn't have the same access to that.
Well, that's a complicated question. I mean, our um, medical system is multifaceted, and there are many ways in which a person can kind of fall through the cracks, and sometimes they fall through the cracks at certain times in their life, and at other times they don't. But I think it's during those times where people have fallen through the cracks that they benefit most from this kind of a clinic. We see the obvious people that we see are those who um, don't have insurance, or maybe are homeless, or without a job. But I would just say, in addition to those folks, we also see people who do have insurance. Maybe they're underinsured, um, or maybe they have insurance, but they have a medical condition where they don't have coverage for their medicines, and their medicines are very expensive. So there's an example of someone who has medical insurance and in employment. they still can't afford whatever it is they need, usually medication. Um, so there's lots of different circumstances that we find people in, and um, and in most cases they are there because they just simply can't afford healthcare. And so we see lots of different walks of life and different people in different circumstances, and I think clinic offers those people an avenue for healthcare, even if it's just temporary.
I think it's so good for all of us to remember that, again, we've talked about this a little bit, but any of us could find ourselves in this situation, right? I think it can be very easy to sort of other people or say it's just this type of person who can't access healthcare. But what a great reminder that sometimes we have healthcare, health insurance, for example, and still can't access the healthcare we need because of an expensive medication or a copay that is too high. And I think another, the Eccles School, we have a graduate of physician. Now that I've started talking about him, I cannot remember his name. So hang on and let me see if it comes to me. It's not coming. I'll just go without his name. At the Eccles School, we have a graduate of our executive MBA program. That might not be right either. Caitlin, I'm going to record this, record it separately, properly with all the information. And I look it up after we're done, but I'm just going to go with what I remember. At the Eccles School, we have a graduate from one of our MBA programs who also founded an organization called Black Physicians of Utah. And he talks a lot about how sometimes receiving bad healthcare can be a barrier to continuing to seek healthcare. And I think this is a very interesting and critical part of the mission of Seager Clinic, that we're talking not just about free healthcare that's easy to access, but it's also non-judgmental. So talk to us a little bit about that, Dr. Johnson. What does that mean to receive non-judgmental healthcare, and how can that impact people's desire or ability to continue accessing healthcare later?
Well, I guess I'd probably say in two parts. The first is just that we don't screen patients at the front door or the front desk to try to determine what their financial situation is. So we don't ask, do they have insurance? Do they have Medicare? Do they have Medicaid? What's their demographics? We don't ask for W-2 forms. We don't ask for citizenship documentation, et cetera. So in that regard, we just take all comers, and so the patients don't have to worry that they have to produce a lot of documents, to prove that they are in need. I guess the second part would be just the volunteers not judging the patients for why they are there. There are people there for lots of different reasons, and we do see a fair number of patients who have addictions. We see a fair number of patients who are homeless. We see some patients who have just come out of prison. We see patients who speak different languages, come from different backgrounds. Some have insurance, some don't. And I think the culture is that we accept them for who they are and withhold judgment. So I think that helps patients feel welcome, because I think in a lot of cases those circumstances, they may feel judged before even being seen.
And I have to
Absolutely.
say, our volunteers, they don't have to be there. They are there because they care and they want to give back. So I think when patients come to us, there's a lot of love in our clinic, because the people who volunteer really want to make a difference in the community.
I love that. I think even if you don't fall into any sort of minoritized or stigmatized group, accessing healthcare can be kind of scary, right? Like, I don't have a blood pressure problem, but my blood pressure reading is always so high when I'm at the doctor's office because I'm just nervous and scared, right? Even when nothing is wrong. So, I think, especially when you are already experiencing a barrier to receiving that care, just knowing that you're coming into a place where people want to be there to help you and these things that you're nervous about won't be pointed out or won't be working against you, I think must make a huge difference. Well, Jerika, we've talked about Seager Memorial Clinic as a safety net. We've talked about it a little bit today, and that's also how you sort of refer to the clinic yourselves. A safety net implies that there are places where people can fall through. Talk to us about what some of those holes are in our network of healthcare, recognizing it is complicated and multifaceted, as Dr. Johnson said, but where are we losing people?
We've already talked a bit about insurance. So, having insurance or not having insurance, there's wonderful partners in the community, Take Care Utah and private insurance companies. They help people get insurance, get Medicaid, and that can be really helpful and kind of catch people. Um, I think, just the financial cost of even copays can be a barrier. Um, Transportation is a barrier. Having, navigating the public transportation system or not having a car, that can be difficult. And then something we've found that's so important is if we can provide as many comprehensive services under one roof, it really helps our patients. For example, we have a Class A charitable pharmacy on site, and we find that it really helps with patient compliance because they're able to meet with a physician or provider and then leave with the medications they need in hand. And that's so critical because then there's not one more step of going to a pharmacy and getting that filled. The more we can do in one place from, when they walk in our building to when they leave, the more likely they are to be successful.
I think, again, just such a great reminder that it can be simple things that we take for granted, like having a car, that can make it difficult for people to access something that they deserve to have and that they need to have. And I really just think that it impacts all of us, even if we realize it or not. The health of our community, the health of our neighbors, our family, it really matters to all of us. I mean, it should matter to us sort of emotionally and socially, right? But I think there also is an economic cost to all of us when not everyone can access healthcare. I read years ago a New Yorker profile, and it was called "Million Dollar Murray." Was the sort of headline, was written by Malcolm Gladwell, and it was about a man experiencing homelessness in the Las Vegas area named Murray, who had complicated healthcare needs and obviously didn't have the means to have them taken care of in a preventative way. And so he would present sort of regularly at the emergency room. And right, he received that care for free as he deserved to do, but they calculated that in 1 year he cost taxpayers $1 million. So even just like down to the dollars and cents, I feel like we should care about it for other reasons more, maybe, but even just down to the dollars and cents, the economic health of our community really depends on people being able to access the care that they need when they need it, and maybe even before they need it, right, in a preventative way instead of in this emergent way that we've talked about a little bit. So, in that vein, Jerika, last year, your clinic saw 2,330. Well, okay, hang on. Let me say this the way that I had it written. I'm sorry, my daughter started playing the piano. Can everyone hear that, or is it just me?
I I can't
Okay,
hear
I
it.
can't hear
perfect. I don't want my track to have like a soundtrack of piano playing. Okay, perfect. So in that vein, Jerika, last year, the Seager Memorial Clinic had 2,330 total patient visits, including one day where you saw 90 patients. I'm guessing that's a high, and that's a lot for the hours that the clinic is open and operating. I'm wondering if you can talk to us about any patterns as far as whether you're seeing the need for your services grow, what kind of changes you've had to make over time to meet increasing demand, and looking forward, what what kind of changes or growth you're anticipating that you might see.
So the day we had 90 patients was for our annual health screening day, where we provide a variety of um, cancer screenings: breast, cervical, colon cancer. We have a dermatologist come looking for skin cancer, free dental cleanings, free immunizations. So it's a wonderful annual event for our community. And, we're seeing more and more patients. This last year, we had over 700 new patients, meaning they came for the very first time. I think more people are learning about the clinic. And to meet the demand, we used to only have one provider scheduled per shift. And now we have two, and they're busy the entire time they're there. So we there's certain clinics that we offer that we always turn people away. For example, our dental clinic, we offer free fillings, extractions, and partial dentures. If you're missing a few front teeth, that can be a barrier to securing employment, just your level of confidence in your appearance. So every time we have a dental clinic, we have to turn people away, which is so unfortunate, because when you're in dental pain, you need help now. And we'd love to expand that by recruiting more volunteer dentists. Also, we see a high demand for our eye clinic, people who need eye exam and glasses. So the goal is to expand our hours of operation. We'd love to be open closer to 20 hours a week by the end of 2026. And that, of course, is going to take more volunteer support from the community. So something we're very excited about is we're in the process of transforming Ogden's former family history library on 24th Street into our new home, where we'll have much more space to expand our services, expand our hours, and see more people in the community. The space is over 7,000 square feet and will include 9 exam rooms, a dental suite with 3 dental operatories, a Class A charitable pharmacy, a room where we can start offering group classes like diabetes management or mental health wellness. We'll have 3 spaces dedicated for mental health therapy in the future. So I feel like this space is really going to be a game changer for our community.
That sounds amazing. And again, just to highlight the mental health aspect, right? I think we're all reading and seeing mental health challenges on the rise as we come out of COVID, especially. And that care in particular can be difficult and sometimes stigmatizing to seek. So I love to hear that there will be more space for, in some ways, the people who need it most and have the least access to be able to access that as well. That really is a huge part of our holistic health. Sorry, let me clear my throat. Dr. Johnson, a little bit later in this season, we're actually going to be talking about AI And this is a technology that impacts a lot of industries, but there are some very interesting applications in the healthcare industry. I know you work outside of the clinic as well in other healthcare settings. And as we think about how to expand access to healthcare to the people who need it most, talk to us a little bit about how you see technology, AI, and even other technologies impacting the delivery of healthcare.
Well, I guess specifically in our clinic, we have our pharmacy, we have a computerized system now for our pharmacy and dispensing medicines, which has been a big, big plus. And then we schedule our volunteers with an app. We have access to an electronic medical record used by local hospitals. So we ourselves do not have an EMR yet, or an electronic medical record. That's something that is probably going to be a discussion in the future to switch to it. It takes some doing to do that. But yeah, we in our clinic try to keep up with that. Our clinic is a little more basic, so maybe we don't have quite the access to the technology that some other mainstream clinics will have, but I think it's all important to keep up with that. As far as what role AI is going to play in medicine in general, that I guess remains to be seen. It's already in various aspects of medicine, and will probably find its way into more in the future. So I guess that's a moving target.
I think everyone agrees. It's so hard to know how it's going to impact us, what role it's going to play in all kinds of industries. But I do think it's exciting, the potential to streamline some activities, automate some activities, and then really free up the human capital resource to in any industry to do the work that's more important, right? And in the healthcare industry, we're talking about the most important work being seeing patients, meeting them, helping them feel seen and heard and taken care of. And certainly, I think AI has a lot of potential to free up providers, especially in a resource constrained environment like maybe the Seager Clinic, to do the work that is the most important. The clinic talks about that work as being a legacy of healing in the community. And I love that phrase, but I would love to hear from each of you what that means to you, what legacy you hope you're leaving, what legacy you hope the clinic is leaving. Dr. Johnson, let's start with you.
Well, I think probably continuing the legacy that Dr. Floyd Seager, standard that he set a long time ago. So our clinic is named after Dr. Floyd Seager. It's the Seager Memorial Clinic. He was a physician in Ogden who, back in the 80s, was in downtown Ogden and witnessed a man collapsing in the street who was homeless, and kind of had a moment where he thought this is a need we have in our community, because we don't have any kind of health care for a large sector of the population. So that's how the clinic was actually born, was through Dr. Floyd Seager. And so he saw that need in the community. And so I think continuing that legacy, for us is going to be continuing to look at the community and see what is the need, and that too is a moving target. And so our job is to adapt, I think, as we see new needs come in to play. I think healthcare needs are always going to be there. Dental is huge, mental health, like was mentioned, even vaccinations, and partnering with other healthcare organizations in our areas is another really important thing, so that we can identify, what patients we can refer to, or maybe have other clinics refer back to us. So I think continuing Dr. Floyd Seager's legacy and adapting to community needs, and that's always going to be ever changing.
That's such a great story, and I think such a great example to all of us that when we see a need, we can do our best to meet it, right? Of a chance experience that could have been brushed off or just treated in a sort of isolated way, instead turned into a comprehensive and growing solution. So I think that's a wonderful legacy to continue. Jerika, as you think of this idea of a legacy of healing, and I think this is so interesting. It's not a legacy of healthcare access, right? It's not a legacy of medication, of healing. What does that mean to you?
I think the legacy of healing is twofold. On one hand, I see it as a way for us to ensure that everyone in our community has a way to get the care they need. When you're sick or you're in dental pain, nobody should have to go without. Everyone should have a place to go where they can be seen and be healthy. Um, I also think that a legacy of healing is a way for the medical community to get back. I think it's healing for our medical community to interact with populations who need care, and I think it's a meaningful experience. A few years ago, the story was shared, and I think it really illustrates it. A, a person who identified as homeless came in, and the nurse was just so kind, like really asking how they were doing, chatting about their life in a really friendly way. And the nurse took the patient's hand and just kind of, just held the hand in a caring way. And the patient started crying and just said, "Nobody's touched me for years." That physical touch, that loving connection. And I think in that way, that connection is not only perhaps healing for the patient, but also healing for that volunteer to make that meaningful connection and interaction with someone they may not have otherwise met. So I'm really proud to be part of this work and to work with so many wonderful people.
What a perfect example that we're not just talking about addressing a healthcare need, but treating people with dignity, right? In a non-judgmental way, in a holistic way, and really that experience of being treated well, which again, so many of us take for granted, but for those in our community, our friends and our neighbors who aren't living in circumstances where they are treated with dignity, where they are seen as whole people, that care and consideration and validation can be just as important as, right, getting your pair of glasses, getting your vaccine, getting your medication, getting your exam. To be seen and treated as a whole person is also something that all of us deserve. And we're so lucky to have a place like Seager Memorial Clinic to offer that care to the people who need it. I'm so grateful to both of you for being here today, and I've enjoyed our conversation so much.
Thank you.
Thank you.
And thank you to all our listeners for tuning in to this episode of the Eccles Business Buzz podcast. We'll be back in 2 weeks with another conversation with an informed decision maker. So make sure you subscribe to Eccles Business Buzz wherever you listen to podcasts so you won't miss it. You can also follow us on Instagram at Eccles Alumni for all the latest news from your Eccles Alumni Network. Until next time. Eccles Business Buzz is a production of the David Eccles School of Business and is produced by University FM.